everyone, so let's move towards our today's topic, which is that is pterygopalatine fossa. Okay, as you all know that fossa means a space, a cavity like thing, a depression like thing, not a depression but a cavity like thing. So pterygopalatine fossa. Now the thing is, the pterygopalatine fossa is present below the apex of the orbit. Okay, in many books of the anatomy it's written like this, ke it is present below the apex of the orbit, but it is not clearly understood by the student that where is the apex of the orbit. Many students are like कि apex बाहर की तरफ होता है. नहीं, the thing is apex is narrower. Like I said, like I told in my lecture of orbital cavity, like I told you in the orbital cavity lecture that apex is basically orbital cavity cone like होती है. तो apex जो है ना inside the skull होता है. That means जो बाहर का एरिया है, जो broad area है जहाँ पे retina मौजूद है, that orbital cavity, that area of orbit is called as base, and inside that the narrower area, the smallest cone like or the corner like area is called as apex. So below the apex it is there is a fossa called as pterygopalatine fossa. Now you have to remember the boundaries as well, superiorly and posteriorly. Again I am saying, superiorly and posteriorly sphenoid bone is present. What happened? The superiorly the body of sphenoid is present, and posteriorly the greater wing of sphenoid is present. Okay, posteriorly anteriorly maxilla or maxillary sinus is present. Inferiorly palatine bone is present. Okay, medially nose is present. Obviously there will be two pterygopalatine fossa on each below each orbit, and on the lateral side of the pterygopalatine fossa infratemporal fossa is present. Okay, now these are the boundaries. Now anterior to this boundary, posteriorly ग्रेटर विंग ऑफ स्फीनॉइड posterior बाउंड्री बना रही है, ठीक है, लेकिन posteriorly कुछ ना कुछ मौजूद होगा. So posteriorly there is a fossa, and as you know the greater wing of sphenoid bone is forming middle cranial fossa. So basically posteriorly posterior to the pterygopalatine fossa there is a cavity, there is a fossa called as middle cranial fossa. Okay, and anteriorly obviously maxillary sinus है, maxilla bone form कर रही है, and so on. Now you have to remember the contents as well. You have to remember that there are three contents. Number one, maxillary artery, maxillary nerve, and pterygopalatine ganglia. The maxillary artery, you have to just remember that the third part of the maxillary artery is involved in the pterygopalatine fossa. But you have to remember that what branches are formed by maxillary nerve, pterygopalatine ganglia क्या होता है, वो कैसे form होता है, and so on. So we will discuss in this lecture. Now maxillary nerve, as you all know that it is a branch of the division of the trigeminal nerve, and it further divided into some branches in which zygomatic nerve is also one of them. Now maxillary nerve will pass through the foramen rotundum, okay, and it will enter into the pterygopalatine fossa. Then in pterygopalatine fossa it gives some branches, that is zygomatic nerve and posterior superior alveolar nerve. Okay, posterior superior alveolar nerve will supply the obviously teeth region, and the zygomatic nerve will enter into the orbit. Okay, and it will supply that area. The another branch which is also called as continuation of the maxillary nerve is called as infraorbital nerve. Now this nerve is important. This nerve, like I said, it is a continuation of the maxillary nerve, so it will enter into the orbit as well through inferior orbital fissure. The zygomatic nerve is the branch of the maxillary nerve which enters into the orbit through inferior orbital fissure. But maxillary nerve, you can say branch, or you can also say that it is basically the continuation of the maxillary nerve. So it will supply the orbit region. Okay, then it will supply further, it will divide, and they will supply the face region as well. So you have to remember these things only. Now, if I talk about pterygopalatine fossa, pterygopalatine ganglia, so it is also known as phenopalatine ganglia. It is also called as ganglion of hay fever. It is also called as Meckel ganglion. So you have to remember all these names. Now, pterygopalatine ganglia is the largest parasympathetic ganglia of the body, and it is basically the station. Now, what is station? Like when we were talking about ascending track, so I have told you that ascending track is like all the neurons will relay the nerve to the thalamus, and then after thalamus they will supply to the cortical region. Same like that, what happened, pterygopalatine ganglia is basically a station for the nerve which are supplying to the face region, which are supplying to the paranasal sinus, which are supplying to the palate region, soft palate, hard palate, lacrimal gland. तो उस एरिया को जो नर्व सप्लाई करती हैं वो बेसिकली टेरिगोपैलेटाइन फोसा पर रुकती मतलब इन द सेंस वहाँ पर नर्व सप्लाई करती हैं, एंड देन फ्रॉम टेरिगोपैलेटाइन फोसा फर्दर ट्रांसमिशन होती है टू दीज ऑर्गन्स, टू दीज रीजन्स. ओके, नाउ it consists of two routes, parasympathetic route and sympathetic route. The parasympathetic route is the nerve which arises from the salivatory nuclei and lacrimatory nuclei. Okay, now lacrimatory nuclei and salivatory nuclei, these nuclei will arise some neurons, and those neurons will enter into the pterygopalatine fossa. Okay, and after that it will supply to the lacrimal gland, to the mucous gland of the nose, and so on. Okay, the sympathetic route, it will arise from the superior cervical sympathetic ganglia. Now, as you know, on each side of the vertebral canal there is a sympathetic trunk, sympathetic chain is running, and in that chain there are some ganglia on each level of the vertebrae. But in the cervical region there are three fusion of the ganglia. Basically there are three ganglia which are formed by the fusion of all the ganglias. Among them, the uppermost ganglia in the cervical region, the sympathetic chain which is in the cervical region, it consists of three ganglia. The uppermost ganglia is called as superior, as it is uppermost, so superior cervical sympathetic ganglia. Okay, so it will pass through the nerve will arise and it will pass through the internal carotid artery. It will not pass through, it will pass near the internal carotid artery. It will enter into the skull. After skull they will enter into the pterygopalatine fossa, and after pterygopalatine fossa it will supply to the face region and paranasal sinus वगैरह वगैरह. Okay, so I am repeating again, the pterygopalatine fossa, the contents, you have to remember the content: maxillary nerve, the third part of maxillary artery, and pterygopalatine ganglia. Okay, if remember this point, if pterygopalatine ganglia is infected, okay, or if it is damaged, so what happened, there will be running nose. Okay, runny nose होगी, ठीक है, or it will due to the lacrimal gland. Okay, and this is called as hay fever, because this condition is basically, like I said, this ganglia is also called as ganglia of hay fever. So this condition is known as hay fever. Okay, so this was the whole topic regarding this lecture. Till then, work hard, study hard, and good luck. Take care. Bye bye. Thank you.